Very simply, plantar fasciitis is the inflammation of the origin of the plantar fascia. The plantar fascia is a band of tissue that runs from the heel to all 5 of the toes. The job of the plantar fascia is to hold the arch up. So in patients that have a contracted calf muscle or a tight calf muscle that leads to Achilles tightness, we'll experience plantar fasciitis because the arch becomes weak and the plantar fascia is under increased stress to hold the arch up because of their tight calf muscle. Plantar fasciitis we will typically see in runners or patients that are on their feet a lot. It's a repetitive use type of a inflammation or tendinitis almost. The plantar fascia is not exactly a tendon, but the tissue is very similar to tendon tissue. And so when it's under repetitive stress due to stress across the arch of the foot, the origin at the heel becomes irritated and inflamed and can cause significant pain. Patients typically will complain of pain first thing in the morning because as we sleep, our arch relaxes and contracts overnight, and then that first step we take that really stretches our arch can be excruciatingly painful. The pain actually typically gets a little bit better as we walk on it throughout the day, and then as we get it more irritated towards the end of the day, the pain can get more exacerbated once again. When we treat plantar fasciitis, we typically like to start with non-surgical management. So typically that's physical therapy with plantar fascia stretches, with calf muscle stretches. Some patients like to wear night splints, which are splints that hold the foot in a dorsiflex position during the nighttime so that they don't have that relaxation of the plantar fascia while they sleep. Some patients will also freeze a water bottle and roll that frozen water bottle over the arch of the foot because that can act to both stretch the plantar fascia as well as to give cool therapy or icing to the plantar fascia and help with the inflammation. We'll also try anti-inflammatories. Typically this is oral anti-inflammatories as the plantar fascia is a little deep for topical anti-inflammatories to penetrate. And then sometimes we'll try orthotic or other non-surgical modalities. If a patient continues to be symptomatic from plantar fasciitis for an extended period of time, we can try injections as well. However, injections into the plantar fascia do carry some risk of rupturing the plantar fascia, so we try to be a little bit more conservative with injections in the plantar fascia. The final treatment, if after 9 to 12 months of symptoms with no improvement with non-surgical management, is actually to lengthen the calf muscle. Historically, people have sectioned part of the plantar fascia and actually cut part of the plantar fascia. However, its job is to hold the arch up. So we found that over time, if you section part of the plantar fascia, then you actually predispose the patient to arch collapse, which can be a whole flat foot, which is a whole nother issue. Surgery for plantar fascia is necessary when the patient decides it's necessary and they've been symptomatic for at least 9 to 12 months without improvement with non-surgical management. The plantar fascia is symptomatic enough that you are not running, not walking around the neighborhood, you're limiting your activities, and we've tried stretches, we've tried therapy, we've tried the anti-inflammatories, night splints, we've kind of exhausted all of the conservative management. That's when we'll discuss lengthening of the calf muscle.